Hello everyone. Have you ever wondered how we measure the penis to place a penile implant? Or how implant size is determined? Even more so, you have noticed that the penis is a bit shorter and you wonder how we can help maximize your length before, during, and after surgery. Let's talk about it. Hi, my name is Jonathan Clavell, and I am a urologist specialized in sexual medicine and penile implant surgery. Similar to other videos, it is important to note that this video is meant to be educational and does not necessarily represent medical advice. Always discuss and clarify things with your specific surgeon. Now, let's get to it. In my clinic, every day I talk to men with ED who are considering a penile implant to help restore their erectile function. And probably the most common concern for men prior to undergoing surgery is, you guessed it, size. Doc, can you make it longer? Doc, what can I do to make sure I get the biggest one? Doc, I used to be X inches. Will I have that after surgery? Doc, does the distal measurement equal what I will see or use? And I get it. For most of us, myself included, the erect penis is bigger and longer than our flaccid penis. Therefore, when you have not had an erection for a while, you look at yourself down there and get concerned that what you see down there is what you are going to get during the surgery. A man with erectile dysfunction who has failed other treatments is at risk of losing size. Wonder why? Simple. The penis is an elastic organ that requires regular stretching to maintain its length. I am sure you have heard the phrase, if you don't use it, you lose it. Well, in a sense, that is kind of true. If you've had ED for a long time, the penis has not been stretching as it used to, and this may cause your penis to decrease in size. If you wonder, well, doc, when I was young, I didn't have sex every day and my penis didn't get smaller. You are correct, but every single night you had multiple erections while you slept. This is why it is important to have those erections at night or in the morning. If you have nighttime erections, remember to celebrate those. Once men stop having regular erections, their penis can decrease in size. Erectile dysfunction can cause your penis to get smaller, which may limit the size of the penile implant that you will get. Now that we understand this concept, let's talk about what can we do to help with size prior to surgery, during surgery, and after surgery, all of those in detail. Let's start by discussing things that you can do to maximize your implant size prior to surgery. Number 1, get an erection. Even if pills are working inconsistently or you are tired of using injections to help you get an erection, if these therapies get you partial erections, use them. Using these can help bring blood flow to give you erections and provide for intermittent stretching, which can help with sizing when you get your surgery. I almost always recommend taking a daily low dose of tadalafil or Cialis. This helps dilate blood vessels in your penis, which will hence bring oxygen to your penis, and oxygen brings health, life. When taking that low dose daily, this could theoretically help bring blood flow to your penis at night while you are sleeping. A low dose tadalafil typically consists of 2.5 or 5 milligrams. Please do not take that 20 milligram tadalafil every day. However, it is of utmost importance that prior to taking these medications, you make sure to discuss with your doctor to see if you can take these medications. Now, please do not take these medications the day of your surgery. Taking erectile dysfunction medications like a full dose Viagra or a full dose Cialis will not impact your outcome during surgery and may put you at risk of having complications with anesthesia. Can you take tadalafil after surgery? As long as your doctor approves it, absolutely. This medication can continue to bring blood flow to the tissues and theoretically improve your recovery. The second thing you can do prior to surgery to improve cylinder size is using a vacuum erection device. Yes, the vacuum pump creates negative pressure and can help suck blood inside the penis. This helps stretch the penis and keep those corporal bodies and tunica albuginea healthy. Remember, your penis has 2 corporal bodies that fill up with blood and a sheath around them called the tunica albuginea. Helping both of these structures to stretch out will help maximize your size. A vacuum device is a great tool to maximize length and girth prior to implant surgery. Wonder how to do this? Simple. First, you need to put lubrication at the base of the vacuum and then place the vacuum pump around your penis and against your pubic bone to create a seal. You will need lubrication for this to work. Then, while you place the pump around the penis to create a vacuum, you then press the button or squeeze the pump if it's not an automatic one, which will allow the penis to stretch. Keep it there until the penis starts bothering you. Once it hurts, stop the suction and hold it for 10 to 15 seconds. And release. Then, while the penis is still in there, suction it again. Hold for 10 to 15 seconds and release. Imagine you're taking your penis to the gym. Make it do 10 to 15 reps of this exercise, and then during the last rep, hold that suction for 2 to 3 minutes. This entire exercise will take you approximately 5 minutes. For men who are motivated, I encourage them to do this 2 to 3 times per day, and if time allows you, every single day. Doing this exercise every day for several weeks will hopefully allow your penis, in theory, to stretch out and help optimize your size. Some of my patients even mark out their gains in the tube of the vacuum pump as the penis stretches over time. To make sense out of this, the way I see it is the following. Imagine you are training for a marathon race. You cannot, or at least should not, go run a marathon without training. Well, now imagine the day of your surgery is race day for your penis. We need to train your penis for race day, and obtaining regular erections, be it with medications or a vacuum pump, will allow your penis to train in order to be successful the day of the race. However, just like with a marathon in which people take a couple of days of rest prior to race day, there is no need for you to use a vacuum pump the last 2 to 3 days leading to your surgery. So if you're traveling to get your surgery done, you do not have to bring the vacuum device in your suitcase. Let me repeat that. You do not have to use a vacuum device 1 to 2 days prior to your surgery. This can lead to unnecessary bruising for the day of your surgery. Important disclaimer. Don't be deceived with what the vacuum pump shows you. There are men who make the mistake of comparing their penile length inside the vacuum pump with their post-operative length. Let me clarify that. What you see inside the vacuum pump will not necessarily be what you see after your implant surgery. Why is that? Let me explain. First, when you use a vacuum pump, you are creating pressure with the pump on your skin and pressing down to your pubic bone. This pushes the skin and your fat against the pubic bone, which gives the impression of a longer penis. Pressing against the bone with a vacuum pump will allow the penis to get exposed more. However, when you cycle your implant, the skin and the fat will still be there, covering part of your implant. The skin and fat that is on top of your pubic bone are still covering part of your penis, which will give the appearance of a shorter penis. Secondly, when using the vacuum pump, you are not only engorging the shaft, but also engorging the glans or head of the penis significantly. And when you are cycling the implant and you are not aroused, the glans is not engorging, which will make the penis look smaller. Therefore, again, do not make the mistake of comparing vacuum length with the visual implant length. What I try to remind men is that what you see inside that vacuum pump is what you will probably use when having sex with the implant, but not necessarily what you will see when cycling. Let me repeat that. What you see inside the vacuum is what you will use after implant surgery, not necessarily what you will see with an implant. Why? When men are penetrating, the partner's pelvis will create pressure against all that skin and fat in the prepubic area, which allows for more exposure of the penis and deeper penetration. Is it necessary to measure the penis before your surgery to determine the size of the implant cylinders? The answer to this is no. The size of your implant is something that is determined during your surgery and not prior to your surgery. Therefore, you should not worry if your surgeon did not measure your penis before your surgery. Now, to the main question. Inside the operating room, how does the surgeon measure the penis to determine the size of my implant? What can the surgeon do during your surgery to help maximize the size? Well, nowadays, the day of the surgery, many surgeons induce an erection at the beginning of the surgery. Once the patient is asleep and everything is prepped and draped, a needle is placed in the penis and we inject saline by creating pressure at the base of the penis, and this maneuver will allow the penis to stretch out to its full potential. And while the penis is on stretch, we do our dissection to measure and place the implant. If you want to see how this is done, feel free to click on the link up here where I show you how I do this in the operating room. You have seen this in my previous surgical videos. We dissect the tissues until we are able to make our corporotomies. Once that opening is made, we measure all the way from the tip of the penis to deep down to your pubic bone. Let me try to explain in case you didn't understand this. As you can see in this picture, part of the penis is inside the body and part of it's outside of the body. When placing an implant, we need to occupy the entire length of that penis, or the patient will end up with a floppy glans. So what we do is we stretch it out with saline measured both proximally and distally. While on stretch, we add those two numbers up, and whatever that total number is determines the size of the cylinders that will be placed. Remember one thing though, that distal measurement is from the point of where the surgeon made his corporotomy and not necessarily what you will see out of your body. So if you are reading your surgeon's operative report and you read that the proximal measurement was 10 centimeters and your distal measurement was 12 centimeters for a total of 22 centimeters, that does not necessarily mean that you only have 12 centimeters sticking out of your body. Your visual length may still be longer than the distal measurement that the surgeon documented in his operative report. So please do not be discouraged with the proximal and distal measurements that we document in our operative reports. These are surgical measurements and not necessarily functional measurements. Can we oversize implants? We can try to be aggressive with sizing of the cylinders, but we cannot put in a cylinder that is longer than what we measured, or we run the risk of having complications down the road. If your penis measures 22 centimeters, for example, we cannot forcefully place a 24 centimeter implant. It won't fit, and if we try to jam it in, you can have problems down the road. What are those problems or complications that can happen with oversizing? Number one, pain. Think about it. You will have an inflatable implant inside your penis trying to stretch it out, and that will cause too much pressure and, as expected, pain. That being said, if you have pain with your implant, this does not mean that your surgeon oversized you. There are other causes for pain after surgery. Number two, deformity of the penis. If the implant is larger than what your penis can tolerate, it will crumple inside your penis and you can end up with a new curvature, among other problems such as severe dog ears. Look at this image, for example. And number three, which is the one that we fear the most, the implant will continue to stretch and expand the tissues of your penis to the point that the cylinders can eventually erode through the skin, otherwise known as cylinder erosion, which means that the implant cylinder can poke out of the penis if it is too big. For these reasons, we measure to fit. We customize things to whatever your penis allows the day of the surgery. But remember two things. Number one, we will do our best to put in the biggest one that the penis will tolerate. We cannot do miracles though. And number two, as surgeons, we aim to do our best to give you the best result possible, for you to be able to enjoy your sex life stress-free and pain-free. Now, after surgery, what can I do to improve my size? You've seen this before, and the trick is cycle, 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 wait, and cycle. Those regular cycling exercises will do wonders. And why did I mention the word wait? Because after surgery, we also need to remember that it takes time for all the swelling around the penis to go down and your penis to get better exposure. I've mentioned this before. The length that you see right after surgery is unlikely to be your final result. There are three things that will help increase length after surgery. Number one, time. Believe it or not, it takes close to 1 year for anyone to recover from any surgery. Ask anyone who's had a plastic surgery or orthopedic surgery. When athletes undergo surgery after an injury, it takes rehab and time for the body to heal completely. With time, the swelling and bruising will continue to go down and the tissues will look more and more normal and your penis will look longer. Number two, arousal. When you inflate your penis and you are not aroused, you are not looking at your erect penis, but instead your flaccid penis, but with an implant. What do I mean by that? When you used to measure your penis during your younger years, it is very likely that you did it when you had a full erection. With a full erection, the penis gets hard, the skin stretches out, and the head or glans penis gets engorged. If you are healthy enough to bring blood flow to the penis, there is a possibility that arousal might bring in blood to the penis that can help enhance the erect penis with an implant. Let me repeat that. If you still have healthy tissues, arousal can enhance your erection after the implant. Some men sometimes get concerned about the skin being a little loose after the implant, and I try to remind them that with arousal, the skin might feel tighter, the penis feel warmer, and the head can engorge. These are all things that will likely only happen if and when you are aroused. And number three, cycling. Cycling your implant helps stretch the tissues from the inside out. I generally recommend cycling once or twice a day for at least 6 months. If you want more details regarding the cycling process and why it is important, I recommend you to refer to my video that talks all about cycling your implant. In summary, the size of the penile implant is determined after we measure the entire length of the penis from the bone to the tip. And there are things that you can do before your surgery, that we as surgeons can do during your surgery, and that you can do after surgery to maximize the size of those cylinders and hence your penis. Before surgery, If not having regular erections, use a vacuum erection device. This helps stretch your penis and prevents it from shrinking on you. During surgery, we can try number 1, induce an erection to stretch the tissues from the inside as much as possible, and number 2, keep your penis unstretched while we are measuring. And after surgery, what you can do is cycle your implant. This will help stretch the tissues out from the inside and help maximize both length and girth. Most importantly, remember one thing: if you found the right surgeon for you, trust him or her that they have your best interest in mind. I hope you found this video helpful. Remember to like, share, and subscribe to our channel. Feel free to ask any questions in the comments below, and see you next time.